How and when to get pregnant after a miscarriage. A miscarriage can be a devastating experience, but it's important to remember that there is hope for future pregnancies. In this video, I will be explaining what causes miscarriages, when it's safe to try again, and strategies to increase your chances of a successful pregnancy. If you're new to my channel, I'm Dr. Amarachi Ijeoma. I am a fertility physician, and my channel focuses on everything fertility and women's health. If this is the kind of content you're interested in, keep watching. Miscarriage is the loss of pregnancy before 20 weeks of pregnancy. Miscarriages are common in the first trimester of pregnancy than the second trimester. When a woman experiences miscarriages for up to 3 or more times consecutively, it is recurrent pregnancy loss. Sometimes there is no reason for a miscarriage, it just happens. In the first trimester, the most common cause of miscarriage is chromosomal abnormality. This is your body's natural way of rejecting a chromosomally abnormal baby. Another cause is if the mother has chronic condition that is not being well controlled. For example, diabetes, hypertension, kidney diseases, thyroid diseases. If they're not being well controlled, it could lead to miscarriage. Also, being extremely overweight or underweight can increase the risk of miscarriage. Smoking, alcohol, hard drugs also increase the risk of abortion. That's miscarriage. For second trimester, incompetent cervix increases the risk of miscarriage. Your cervix is the neck of your womb, your uterus. It is usually where the baby comes out from. In some women, the cervix is not strong enough to hold the baby till term delivery. And this can be because of previous pelvic surgeries. Sometimes the pelvic is weak, but without any known reason. To prevent further miscarriage, the solution is to put a stitch on the cervix during the next pregnancy. Abnormalities of your womb, that's abnormalities of the uterus, like an abnormal shape of the uterus or fibroids, depending on the size and location of the fibroids, can cause miscarriage. And pelvic infections also increases the chances of miscarriage in second trimester. When is it safe to try again? Firstly, it's important to acknowledge the emotional healing process after a miscarriage. It's normal to experience a range of emotions, including grief, sadness, anger, or guilt. Allow yourself the time and space to grieve and seek support from loved ones, support groups, or professional counselors who specialize in pregnancy loss. Remember, healing emotionally is an important step towards preparing for a new pregnancy. So while emotionally healing, it's also important to consider your physical recovery. The time frame for physical healing after a miscarriage varies for each woman, depending on factors such as age of the pregnancy at the time of the miscarriage and any underlying medical condition. The question many couples ask is, when is it safe to try again? There isn't a one-size-fits-all answer to this question because it depends on individual circumstances. However, waiting for at least one menstrual cycle to occur after a miscarriage is recommended. This allows the body to heal. It allows the lining of the uterus to rebuild and the emotional healing process to progress. Now, I'll be telling you different ways you can increase your chances of a successful pregnancy after a miscarriage. While there are no guarantees, following these steps I'm about to tell you about may improve your chances of getting pregnant after a miscarriage. 1. Schedule a preconception checkup with your doctor. That is, schedule a consultation with your doctor before you attempt your next pregnancy. Your doctor will assess your overall health, review your medical history, and provide personalized recommendation or treatments tailored to your specific needs. Adopting a healthy lifestyle is important for fertility, just like I say in almost all my videos. Focus on maintaining a balanced diet, regular exercise, managing stress, and avoid smoking. Avoid drinking alcohol as well, and avoid excessive caffeine consumption. These lifestyle choices can contribute to optimizing your fertility health. If you have any chronic medical condition, make sure they are well controlled before planning your next pregnancy. If you have any pelvic or genital infection, get it properly treated before trying again. Start taking a daily folic acid supplement before you conceive. Folic acid is important for the development of your baby's neural tube and can help to reduce the risk of certain birth defects called neural tube defects. For example, it prevents the risk of your baby being born without a brain or with a tuft of hair on the back, and so on. I can't overemphasize the importance of folic acid when trying for a baby. If you're experiencing recurrent pregnancy loss, get your uterus evaluated. You can do this with a procedure called hysteroscopy. In hysteroscopy, a camera is inserted into your womb, your uterus, through your vagina, in order to evaluate what is going on inside your uterine cavity. If there are any findings, treat immediately before you try to conceive again. Understand and track your menstrual cycle using methods such as manually calculating your menstrual cycle. You can use ovulation prediction kits or smartphone apps, really. Understanding your cycle can help you identify your most fertile days and time intercourse accordingly. If you want to know more about calculating your menstrual cycle, your ovulation, and your fertile period, I will attach the link above. Don't underestimate the importance of emotional support during this time. Reach out to your partner, your family, friends, or support groups who can provide understanding and encouragement during and throughout your journey. It is understandable to feel anxious or stressed about the possibility of another miscarriage. Remember that each pregnancy is different, and the occurrence of one miscarriage doesn't necessarily mean that it's a higher risk for further pregnancies. About 90% of women who have miscarriages go on to have successful next pregnancies. However, if you still have concerns, discuss them openly with your doctor. They can provide reassurance, additional testing, or recommend treatments that may be helpful to help you reduce your anxieties. Getting pregnant after a miscarriage is a deeply personal journey. Take time to heal, emotionally and physically. Remember to take care of yourself, seek support, and stay positive. I'm wishing you strength, hope, and success on your fertility journey. If you found this video informative and you want more content like this, please like this video, subscribe, share with your friends. If you have questions, drop it in the comment section below, and see you in my next video.